Whenever you're ready, just tell me when you start. Okay. I'm taking appropriate BSI precautions and checking that the scene is safe to enter. I am noting that there's one patient, and that the nature of the illness is potentially a head injury. I am assessing the need for additional resources. Because it's a head injury, I'm going to call for more, and I'm taking appropriate C-spine precautions as necessary. So I'm entering the scene. I see an approximately 20-year-old male in mild distress. Hi, my name is Kyle. I'm an EMT. I'm here to help. I'm going to ask you a few questions, okay? What's your name?
Sierra.
And do you know where you are right now?
Home.
And do you know what time it is?
10.
And how many quarters are in a dollar?
4.
Perfect. So based on his responses, I'm going to put him on an A on the AVPU scale for alert. Can you tell me what your chief complaint is?
I passed out and hit my head.
Okay. So I'm noting that the head injury is a potential life threat. I don't know yet. So I'm moving on to ABCs. I'm watching the airway for patency, noticing signs of gurgling, snoring, or stridor. And I'm going to do respirations and heart rate now because I can get the other things that way. So for 30 seconds, counting. And then okay. It was 80 strong and regular, 80 strong and regular for the heart rate, and it was 16 respirations. So I was watching for adequate rate, which was normal, and tidal volume, which was normal, and the assessing for signs of a pulse, which was obviously there. I was getting the other signs while I was at it. So next, so for breathing, I'm also going to, even though the rate was regular, I'm going to oscillate for lung sound. So I'm putting on my imaginary stethoscope right now. I'm going to ask you to breathe in and out for me, okay? Can you breathe in? Thank you, and out. In, and out. In, and out. And in, and out. And we're just going to say that was normal. And then, so that was adequate. If it wasn't, I would perform appropriate BLS maneuvers and apply appropriate adjuncts. For the other stuff, I would, if it was not normal, I would ventilate and apply oxygen as needed, but everything was fine. What's next? Okay, so skin is pink, warm, and dry. So that's skin signs, and then I did lung sounds, and then assessing for signs of shock, which are not present. If they were, I would make sure the patient was positioned appropriately, cover him with a blanket to preserve body heat, and control any severe bleeding. Based on a GCS of 15, I'm going to say it's low priority for transport. Yeah. And then we're going to move on to sample. So, going through sample, starting at signs and symptoms. So, can you tell me when this started?
About 5 minutes ago.
Okay. D, does anything make it better or worse?
It hurts when I touch my head.
Okay. Q quality. Can you describe the pain?
It's like a throbbing headache.
Okay. And does it move or change?
No,
Okay. And can you rate it on a scale of 1 to 10?
about a 4.
4 to 10. And how long have you been feeling it for?
For a couple of minutes.
Okay. So for vital signs, I already took heart rate and respiration, so I just need to do blood pressure, which again, it's all imaginary right now, so I'm putting the blood pressure cuff on, make sure it's lined up and all that. Listening. And I'll just say it's 112 over 76. And then, so I'll write that down. That's fine. And then, I have to go through the rest of sample. Do you have any allergies to medications that I should know about?
No,
Do you take any medications?
no.
Has this ever happened before?
Yes, I have POTS.
Okay. And what was the last thing you ate or drank?
I had a toast and orange juice for breakfast.
Okay. And can you tell me about the events leading up to the incident?
I fell and hit my head when I woke up, so I had already called 911.
Okay, you passed out and hit your head, but that's fine. Okay. So, did I say priority? I did, didn't I? I think I already fucked up, but so again, low priority. For interventions, I'm gonna make sure that he's sitting down, which he is because of his POTS, and I'm gonna apply ice to the head wound, and we're gonna wait for the ambulance. But while we're waiting, I'm gonna do secondary assessment. So starting at the I'm checking for decap BTLS on all of these for the record. So starting at the head, I'm checking for pain and scars. For the face, I'm checking muscular symmetry. Can you smile for me? Thank you. For eyes, I'm checking for dilation, reactivity to light, color, equality, and pink moist conjunctiva. For the nose, I'm checking for flaring, drainage, foreign bodies, or singed nostrils. Can you open your mouth for me? Thank you. I'm checking for loose or broken teeth, blood, foreign bodies, and pink moist mucosa. Checking the ears for drainage. Checking the neck for jugular vein distension. And stoma, and accessory muscle use, and scars, and medical alert jewelry. Then I'm checking the chest for pain, equal chest rise. I already did lung sounds, and chest rise, lung sounds, paradoxical movement. I think it's called retractions in this, and rashes and scars. Checking the abdomen for pain, rigidity, distension, guarding, pulsating masses, scars, and rashes. Checking the pelvis for pain and incontinence and pregnancy, which obviously isn't relevant. Checking the legs for track marks, medical alert jewelry, pedal edema, and distal CSM. So can you give me your feet? Tell me which toes I'm touching.
Big toe.
Can you push down? Can you push up? Checking capillary refill. Looks good. Checking the arms for track marks and medical alert jewelry and distal CSM. So can you tell me which finger I'm touching?
Index.
Can you push down? Push up? And checking capillary refill, and it looks good. arms, and then back, checking the back for pain and rashes and scars. And then after sample, I would do vital signs and ABCs again, and then I state the effectiveness of my, no, that's afterwards. Oh, then I would compare the vital signs, which I'm just going to say that they would compare normally. And then I would evaluate the effectiveness of my interventions. And I'm going to say that he's improving because the pain hasn't gotten any worse, but we're still waiting for the ambulance. And then if anything was wrong, I would adjust accordingly, and that's time end. Then I would do
10:50.
perfect. And then I would do the verbal handoff, which is male, approximately 20, passed out and hit his head. Pain is a 4 out of 10. Happened a couple minutes ago. Happened 5 minutes ago, and he woke up a couple minutes ago. I would give the vital signs: no allergies, no medications currently, has POTS, last oral intake was toast and OJ, etc. Oh, and I would say my assessment of what is wrong is that it was most likely the POTS that caused him to pass out. Other possible cases for it could be insulin shock, but I'm going to rule that out because POTS is more likely, and his last oral intake included OJ, which has sugar in it. So, yeah. Oh, and DCAT BTLS is deformities, contusions, abrasions, penetrations, BTLS, bruising, tenderness, lacerations, and swelling. And I think that's everything.